All right, rejuvenation techniques for the upper 1/3 of the face. Things to consider are the patient's hairline. Is it stable or is it receding? Is it going to recede in the future? The length of their forehead and the position of their eyebrows. To address the hairline, we can do hair transplantation or lower the hairline in someone with a stable hairline, typically in women, where an incision is made pretracheal just at the hair, and all this is lifted, and then the hair is brought down. Extra skin from the forehead is then removed, so that works excellent in people with long foreheads. It's also known as a hairline lowering or a forehead shortening procedure. If that same patient also happens to have low set eyebrows that they want lifted, the dissection can be carried like a brow lift where all these ligaments are released, and so then it gives us control to shape the brows. Now, you have to be very careful doing this in men because you have to consider where their hairline is going to be in the future, and you don't want that incision to show. If you don't want to mess with your hairline, there's an endoscopic brow lift. Little incisions are made here, 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 and that gives access for an endoscope or dissecting tools to release all these ligaments to then lift the brow position. However, if the patient has a long forehead and you do an endoscopic brow lift, you are pulling to lengthen the forehead. Do not advise doing an endoscopic brow lift on a person with a long forehead. So in a patient with a big forehead, thin hairline, but big bushy eyebrows, you can hide an incision just at the upper edge of the eyebrow, excise skin, and set the brow. It's a direct brow lift, usually in older men, but can also be done in women. My favorite brow lift technique is a lateral brow lift. You can make an incision back in the hairline, just about this big, and it gives you access to all of this area to dissect. You can pull the corner of the brow and set it where you would like. If you pull on the middle brow, sometimes people get a surprised appearance, which you want to avoid. People will go and release the corrugator muscles that help us frown, thinking that you don't have to do Botox. I advise caution in this move because if you look at some people who've had it done, they end up with really far set apart eyebrows, and it is not a natural look. So in review, know what your hairline is doing, plan for the future. If the forehead is long, consider reducing the forehead, avoid an endoscopic brow lift, and if the brows are low, usually a lateral brow lift, just the corner through an incision right here, will get you snatched just the way you like it.